when you prepare for an inspection, look at everything. Okay? Make sure it's all okay. Every firm should do this, or these things. So create an inspection response team. Okay? The team should have representatives from the quality unit, design, development, manufacturing, warehousing, distribution, purchasing, the IT function, facilities and engineering, and of course validation. Now under engineering, that may include either engineering or maintenance. Things like calibration would fall in there as well. Okay. Haven't been in an inspection yet where calibration didn't come up. So the primary and you should have primary and secondary hosts. You never know when somebody becomes ill, and you never know when you might get more than one inspector, and you may have to run more than one room. I can remember an inspection at a pharmaceutical manufacturer, a fairly large one. We had 7 inspectors, okay? 5 rooms running simultaneously. That takes a lot of resources to do that, you know. So in a very short time, you can have 100 days of inspection under your belt. Right? But most medical device firms are not the size of some of the pharmaceutical firms at a single facility. And it may not be likely that you would have that many inspectors, but you certainly could have 2 inspectors. Okay? Going in different directions, by the way, not doing the same thing. You know, so you want scribes, and you want to appoint at least 4 scribes, 2 for each room. All right, we'll get into the function of that if you've never used those. You want a communication system. We'll talk about that a little bit and why you want that. And the setup of the front and back rooms, what those functions are, what should be in them, the back room lead or coordinator, a vital job, and the document request process. Okay. You also want to review your past, should be 483s, and any regulatory letters for completion. So if you've received any regulatory letters, any responses that you've given the FDA, those were all accepted. Make sure all those things are done on this inspection, right? Because they will, one of the first things that they're likely to do is look at the results from the previous inspection and make sure that everything that you committed to has in fact happened, right? Well, you know what happens if it's not done, right? And it'll be an interesting day. If you are expecting a pre-approval inspection, make sure that you have a copy of the filing and review it before the inspection. Typically on a pre-approval inspection, the agency will call you and tell you that they're coming in about a week. Okay? On biannual inspections, that's not necessarily so, or on any other inspection other than a pre-approval inspection, you're not likely to get notice that they're coming. And that means they just pop in the lobby and hello, let's go. So preparation is everything. Even if you do get a call, you only have about a week before they show up. Now, the second that you file a PMA, or if you're on the drug side, an NDA or ANDA, the second you file, it takes the agency about 2 weeks to accept your filing. And they will notify you when they accept that filing. Okay? So they've done a preliminary review of it. All the components seem to be there. We'll accept the filing. From that point on, you are immediately subject to inspection at the manufacturing site. Okay? Normally, that takes 3, 4, 6 months before that ever happens. Just because of the process, they usually don't do that inspection until they're nearly through with the review of the filing. Having lived through this once, we filed 2 weeks later. Well, it was 3 weeks later. 2 weeks, they approved it. 3 weeks later, got a call. 4 weeks later, they were on site. Okay? And they wanted to come the next day. I was able to delay them a few days because my manager of validation happened to be on vacation. And that was the only reason that they would delay it. Now, frankly, in a week, you can do nothing if you're not prepared. If your facility isn't done, I mean, it's not like you can validate anything in a week, right? You need to be ready when that filing goes in because you don't know when they're going to show up. Okay? Don't bet on that 6 months. Luckily, we didn't. You know, that was our thought was, oh, it'll be 6 months before we see them. It wasn't. It was 4 weeks. Okay. Other things that you want to look at in advance. Any open complaints? How long? You know, have they met all the time requirements? that are set in your procedures or by the agency. MDRs have a certain time requirement. That's part of the complaint system. Make sure those things have been filed on time. You will get cited if they're not. Almost guaranteed. Okay? Review all your open CAPAs. Are there any lingering CAPAs? So generally in any CAPA system, internally you've set some time limit for that CAPA, and internal to the CAPA you've set some time limit when certain activities have to be completed in that CAPA, right? They're going to ask almost always for a list of all open CAPAs. They may ask for a list of all the CAPAs for the time period that covers the dating of your product. In a lot of cases that's 2 years. The medical devices can be much longer than that, but you know, they'll focus on a certain time period for that. Okay? You want to look at those things, make sure that everything that's supposed to be closed is in fact closed, right? And if it isn't, I would put some resources on that to get that done. Right? First thing, when I'm an auditor, I'd look at, you know, there are some simple key things to look at. You look at complaints, you look at CAPAs, you look at nonconformances. Gives you a big story of what may be going on in that facility. But you, as the firm, you want to know this in advance. You may be able to take some actions, you might not be able, but you can certainly find out what the situation is, and you can present the best possible story if the situation comes up to the inspector. You want to review your management quality review meeting and action assignments. They won't look at the minutes, but they're going to look at the CAPAs, okay? Those action assignments should all be CAPAs, generally speaking, okay? So you want to make sure that that's another vector that they can go down to look for things. Review your internal audit plan and findings. They will not look at your audits, but they will ask you for the plan, okay? And what they'll ask you for, were these things done on time? So if you said that you're going to do 3 audits in the first quarter, you better have had those 3 audits done in the first quarter, or some good reason why they're not. Because that just shows them that you are not complying with your internal procedure. Because generally your audit procedure says that you will produce a plan every year. Thus the plan becomes part of the SOP. When you're not following the plan, you're not following the SOP. So goes the logic, right? You also want to look at reviewing all out-of-specification reports, all out-of-calibration reports. Are they all closed? So more so on the pharma side, you can have a lot of, or depending on the type of product that you're making or combination products, a lot of analytical testing is done. In the medical device side, there's a lot of physical testing as opposed to analytical chemistry type things going on. But it's not unusual to have an out-of-spec result, and that triggers an out-of-spec investigation to determine whether that result is a valid result or not. Okay? And it's not the kind of thing where you take the best, you know, the best 2 out of 3 kind of thing. It's, you know, if you have a failing result, you have to thoroughly investigate why that is before you release that lot, right? You have to have confidence that that lot is okay. They will ask for those things as well. Out-of-calibration report is a similar thing. It's an out-of-spec, but for a calibrated instrument that presumably, if it's calibrated, it has a major effect on the production process and the product, right? So if it's out of calibration for whatever reason, you need to have thoroughly investigated that the effect of it being out of calibration does not have an adverse effect on product that you've already shipped or is still in-house. Okay. Are there job descriptions for all, or make sure that you have job descriptions for all GXP positions? They may ask for those job descriptions, and this goes to the training. Okay, review your training program. So one way that you have to when you determine what job requires what training is through what the job description is, right? One thing that I frequently find is 2 people doing the same job with vastly different training records, right? Now you have some explaining to do, and you might not have a good explanation for it, right? In a lot of companies I've been in, the manufacturing manager over that particular area is responsible, according to their SOPs, and this is frequently the case, for the training program. What training each position under that manager has, what training each position must have, right? Well, that's not exactly a system. That seems to be, open to interpretation by whoever happens to be the manager this year. Right? And so what happens is you get people with different training backgrounds doing the same job.